So previously, the wards would contact a community mental health team and say, X, Y and Z needs doing before this person can be discharged. Camden and Islington had a high number of over 50-day stayers, and there was always a delay between sort of transferring that information and the community teams acting on it. Acute hospitals have something called an integrated hospital discharge team, which is a team that purely focuses on doing the practical bits and pieces to help get patients out of hospital. So I was shown a proposal from Look Ahead that described such a team, and I thought to myself, actually, this is perfect, and it's working unbelievably successfully.
So there's two services. One helps the patients be discharged from the hospital wards. The other service helps the patient acclimatise to living outside of the hospital environment. Generally that might involve medication.
So people here tend to be quite unwell, and we work with people with a real range of diagnoses. So it's kind of psychotic illnesses like schizophrenia, bipolar disorder, like major depressive episodes, personality disorders.
So our service provides a support network for people who otherwise wouldn't have one, especially people who maybe come from abroad or just don't have that social network. And I'm pretty sure that if it wasn't for our service, they would have ended up, out on the street or then back in hospital, very likely.
In the past, I'd quite often find that the work that I could do had been largely done. The patient's symptoms had improved, but there were a whole bunch of complex social issues that were preventing the person from being discharged. We've always been fairly good at identifying what the social issues were, but in the past we would identify them, but we wouldn't have a clear mechanism for addressing them. That sounds simple, but it's such a transformative change.
We thought it would reduce our length of stay, but what we found was an unintended consequence, that our emergency readmission rate dropped drastically. And that's important because when people come back in with an emergency readmission, essentially it's a failed discharge, they end up staying on the wards a lot longer. So that is a really positive thing. So this team is Look Ahead staff, social workers from our local authorities and nurses from our trust. So it's a really truly integrated partnership team, and I think that partnership working really brings out the best in each other to try and get the best for the patient.
And also they're flexible. They've got access to, for example, vouchers for people to use for food. They've got access to temporary accommodation. They're developing expertise in applying for travel documents to help to repatriate people.
It's not just a fixed list of things you do. You can literally do anything to ensure that somebody's, discharged from hospital safely, remains outside of hospital, and we prevent readmissions.
We'll attend the multidisciplinary team meeting, which is involving the doctors, nurses, occupational therapists, everyone who's involved in the patient's care who works on the wards. There's a lot of communication between the different agencies. I think that's worked really well from our perspective, but also from a patient perspective.
I think the principal reason for the service is to stop people being readmitted to hospital, and you can see how that would happen in real time when I go out and see people. If there has been a case of somebody, I've noticed they're not taking this medication here and there, then that can be immediately raised. While if there was no team like me going out and doing that, then that sort of thing would go unnoticed, and it would only show up however many weeks later when that person has a relapse. We see people ideally for 6 to 12 weeks, sometimes extended longer if they're particularly we've got one guy for instance who's undergoing chemotherapy, so we're just basically seeing him until that's sort of over.
The feedback we get is something that reassures us that we are having a massive impact on the hospital, bed states, quality of care provided after discharge from hospital as well. It's good to hear.